Well, we've been bombarded with data this past year. The number of people sick with COVID, the positive rate of cases. Well, now reporter Dan Grossman is showing us an in-depth look at new numbers that are giving parents pause as they make the decision whether to get their kids vaccinated.
Maybe the decision to get your kids vaccinated was easy, but for many parents, it hasn't been. And new data shows the dropping effectiveness of the vaccine in younger kids is now driving more parents away from getting their kids the shot.
2 weeks after getting fully vaccinated, CDC numbers showed the vaccine is 66% effective at preventing Omicron infection in adults, 76% effective in 12 to 17-year-olds, and 66% effective in 5 to 11-year-olds. The real surprise, however, comes when you fast forward another 2 weeks, and the vaccine's effectiveness doesn't change in adults. It changes in teens, but it plummets in kids.
The efficacy has gone down.
Laura Ann Cleveland is the Associate Chief Nursing Officer at one of Colorado's largest pediatric hospitals. She says there are two things in play here. The more recent COVID variants have mutated around the vaccines to a degree, and the dosage in the youngest of kids is about a third of what it is in adults.
Really trying to understand what dose of vaccine is needed for each variant, as well as the side effects that you would have, because you want both. You want the high enough dose to get the strongest efficacy and the low enough dose so that you won't have side effects. So it's that balancing act.
According to the CDC, after the first 11 weeks of the vaccine becoming available, 51% of adults had gotten one shot and 41% had gotten two. But in kids 5 to 11, that number is only at 28% and 19% respectively. Surveys by Pelos, a nonprofit science publisher, shows effectiveness is the second largest thing parents weigh when deciding whether or not to get their kids vaccinated.
Because COVID-19 has mutated so many times, the New York State Department of Health has urged its vaccine manufacturers to up its dose in kids, but it still recommends the vaccine for every age group. I'm Dan Grossman reporting.